So let me read this question with you and help you navigate this information. So a 35-year-old woman, 10-year history of daily alcohol consumption, presents with a progressive external dyspnea, orthopnea, lower limb edema. So this arises probably, let's say probably, okay, we'll get to the diagnosis. This arises probably due to fluid in lungs, in very simple language, exertional dyspnea, orthopnea, okay, so, and probably related to some kind of heart failure, okay, lower limb edema, again, edema probably could have built up in the, systemic circulation, okay, because of heart failure. So let's see. Okay, let's not jump to a conclusion yet. So because there are, as you know, many reasons that can lead to edema. Okay, on exam, she has elevated jugular venous pressure, so definitely something happening with the right side of the heart. Displaced and diffuse apical impulse. So if some heart, sound locations are being displaced, maybe. So I'm again saying maybe some structural sort of thing has happened with the heart. Okay, so let's look at more information. Okay, and a third heart sound. This is very specific. So heart sound S3 and S4. Okay, so S3 S4 do tell us about some structural thing going on with the heart. So we talk more about that in a bit. Okay, so this is a patient with third heart sound. Okay, chest X-ray. Okay, that's what you would have done next. So I like when they give you so much information in sequence. So chest X-ray shows marked cardiomegaly. So they've given us the direct information now, and pulmonary vascular congestion. So this was what we were thinking about, the fluid backing up into the lungs, right? So definitely heart failure and cardiomegaly definitely is what we see in the chest X-ray. Uh, Further, you can do echo. Okay, that's what we will do. Echocardiography reveals enlargement of all cardiac chambers. So they've basically given you the diagnosis here. So enlargement of all cardiac chambers, a thin left ventricular wall. So basically, the heart is in a very dilated situation, and then they say a reduced movement of the interventricular septum. So they've actually described. So why I gave you all of this information? Of course, this made the question easy, but I want you to learn this description of dilated cardiomyopathy. Okay, this is how we describe dilated cardiomyopathy. Okay, uh, sometimes in your comprehensive NBME questions, they would, like I always tell you, they would not give you so much of information. Okay, so they might just simply say 35-year-old exertional dyspnea and then directly jump to what the echo findings are. So echocardiography reveals, and they can sort of pick one out of these findings, mix and match. So they want to give you less information. USMLE step one questions, they do give you some, additional information as compared to your comprehensive questions. So that is why some of you definitely feel that comprehensive is a difficult exam because of how the questions are. Okay, so let's look at the options. So question is, which of the following additional findings would most likely be observed in this patient? So this is option A, increased left ventricular end diastolic volume with reduced ejection fraction. Okay, let's look at option B. It says severe thickening of the interventricular septum with preserved ejection fraction. Option C says marked reduction in chamber compliance with restrictive diastolic filling pattern. D is severe calcification of the mitral valve leaflets with reduced leaflet mobility. E is systolic anterior motion of the mitral valve with dynamic left ventricle outflow obstruction. So I'll show you that the correct answer. So these are all the option explanations. So option A, of course, is our correct answer, which is directly describing, or it's a description of what happens, in a dilated cardiomyopathy patient. So option A, let's look at this. It says increased left ventricular end diastolic volume with reduced ejection fraction. In very simple words, what has happened here? So we diagnose this person to have a dilated cardiomyopathy, right? So what does that mean? Cardiomyopathy means heart muscle disease. If I literally break that word into three bits, so heart muscle disease, right? Cardiomyopathy, three words, right? Dilated is heart is dilated all the four chambers are dilated, okay, because heart is having some problem with sort of contraction or energy generation in the myocytes. We'll talk about that. So heart is dilated. So would there be too much of blood in the heart? Okay, with every cycle, there is going to be a lot of blood, extra volume of blood in the heart. Okay, so because of that dilatation, okay, and that dilatation, heart would try to generate more force, but there is some force generation problems in dilated cardiomyopathy. Okay, and that is how it also would develop some hypertrophy. But what type of hypertrophy would happen here? What type of? There are two types of hypertrophies if I categorize them into two, eccentric and concentric. Okay, in this case, because heart is dilated and like pretty expanded, huge, large heart. Okay, so this leads to what is called as eccentric hypertrophy. In eccentric hypertrophy, the heart muscle cells are arranged. What do you remember? In parallel or in series? So this is hypertrophy. Heart muscle cell size and volume is increased, but increased in a specific way. It's eccentric, not concentric. Okay. Concentric is when they are parallel to each other. Eccentric is when they lie in series. Okay. So series versus parallel. So that is eccentric hypertrophy, but this is hypertrophy in a dilated heart. Okay.